Good morning, everybody. Opening the Committee on Health, Human Services, and Homelessness for the purpose of hearing an agenda for Tuesday, February 15, 2022, 9 a.m. agenda. We have some rules to review. To the audience, the committee has instituted a 2-minute time limit. So the chair and members would like to emphasize that please stay within your 2 minutes. Also to let those testifying know that one of the most important parts is the ability for members to ask questions and get further information. However, today we do need to end this agenda. We have another joint at 11. The morning committees are not allowed to reconvene in the afternoon. So in order to decision make to this agenda, we need to move through the bills this morning. Just want to highlight that please keep yourself muted and your video off while you're waiting to testify. The Zoom chat goes to tech staff. We do not see it. If you are disconnected unexpectedly, please just attempt to rejoin. If the network fails, it may be necessary to reschedule the hearing. However, these bills have some deadlines. Please avoid using trademarks or copyrighted images, and please refrain from profanity and uncivilized behavior. And please remember paid lobbyists and staff that to please remember it's a 2-minute time frame. Okay, so moving to the first measure, HB 1762, relating to language access, DCCA.
Good morning, Chair, Vice Chair, members of the committee. Kat Awakuni-Kalon on behalf of DCCA. The DCCA appreciates the intent of the measure. We also offered a couple of suggestions. We suggested that the Language Access Office receive resources in order to conduct an assessment across the entire executive branch to determine, what additional services could be provided. In the alternative, we also suggested that perhaps the position designated for DCCA could be placed within Office of Language Access to bolster that office's ability to help DCCA and other departments. I'd be happy to answer any questions you may have. Thank you for the opportunity.
Thank you. Office of Language Access.
Good morning, Chair Yamane, Vice Chair Tam, Afirak Bamdunguyen for the Office of Language Access. We stand on our written testimony offering comment and will be available for any question the committee may have. Thank you, Chair.
Thank you. Department of Human Services.
Morning, Chair, Vice Chair, members of the committee. Kathy Betts for the Department of Human Services will stand on our written testimony supporting the intent and deferring to OLA. Thank you.
Thank you. Department of Health.
Good morning, Chair, Vice Chair, members of the committee. Lauren Kim for the Department of Health. We will stand on our testimony supporting the intent and specifically the idea of dedicating more resources to the Office of Language Access. And we actually received DCCA's first recommendation for an amendment for an executive branch survey. We would support that as well. So thank you for the opportunity to testify.
Thank you very much. Okay, hi, Emma.
Good morning, Chair, Vice Chair. My name is Luke Myers. I'm the Administrator of the Hawaii Emergency Management Agency. We stand on a written testimony offering comments on the House bill and are available for discussion as necessary. Thank you so much.
Okay, thank you, Ms. Myers. Hey, Hawaii Friends of Civil Rights.
Good morning. Good morning, Representative. We stand on a written testimony in support of this bill. We appreciate the comments of that have been provided by the department leads, suggesting perhaps a statewide assessment. We support additional resources for OLA and positions in OLA. Thank you very much.
Okay, thank you. Waipahu Safe Haven Resource Center.
Aloha committee members. I'm Barbara Tom. I'm the director of the Waipahu Safe Haven Immigrant Migrant Center. I support this bill. And as director, we've been working heavily with the community, addressing the needs that the community has identified, in particular the Micronesian community, who were heavily impacted and suffered disproportionately from COVID. During the beginning of the pandemic, our resource centers for Micronesian interpreters were barraged by calls from morning to night from individuals asking for advice and assistance with quarantine, wraparound services, unemployment, and isolation. Many of the families and individuals did not understand English, cannot use technology, do not have transportation, and sometimes do not even have a phone. These families were living well below the poverty level. Although there were translated materials on the city and state website as well as others, it was not accessible for these families. The limited English-speaking families were still unaware of the resources and who to call to get help to help them navigate these services for COVID-19. Even taking the vaccine was a struggle for them as they were receiving erroneous information from others and their social media sites, and many would not go to the clinics if there were no interpreters provided, and oftentimes there was none. This bill offers an important step towards solving this problem. This is crucial so that all members of the community can obtain essential resources for them they are entitled to. These families who are unable to access the needed resources and are also subject to homelessness, when this is all very preventable, providing language access to help them navigate the services for themselves and their families. I fully support this House Bill 1762. Thank you.
Okay, Hawaii Coalition for Immigrant Rights.
Aloha, Chair, Vice Chair, and members of the committee. My name is Liza Ryan Gill with the Hawaii Coalition for Immigrant Rights. We represent more than 25 immigrant serving and immigrant-led organizations across the state, and we strongly support the intent of this bill. This was our #1 priority by our organizations. They all voted that we should expand and give more support to our more than 18% of our population that is foreign born, 50% of which are naturalized citizens. So our comments are in our testimony, and we're willing and open to work with the chair and other departments on how we can best put something together to keep serving these folks.
Amy Agbayani.
Aloha, Chair and Vice Chair. I fully support this bill, and I believe that additional resources to the Office of Language Access would be very appropriated and effective. So thank you very much for hearing this bill and for your support for language access. Thank you.
Thank you. Okay, we have testimony from Department of Ag in support, DLIR in support, Budget and Finance providing comments, Office of Community Services in support, Common Cause providing comments, Legal Clinic, Hawaii Coalition of Immigrant Rights in support, Hawaii Public Health Institute in support, and a whole list of individuals all in support. Okay, members, any discussion or questions? Okay, seeing none, the chair has a quick question for Office of Language Access.
Yes, Chair.
Okay, currently the bill has positions instituted within the departments, various departments. The way I read it is those then individuals will report to the department directors and not to OLA. Would you be opposed to having positions as requested within OLA and have them assigned to be able to help the departments meet all their federal and state access requirements?
Chair, I believe there is different approach for this bill. If you don't mind me explaining a little bit, for this bill, I believe that they try to bring a coordinator from within the department, bring their expertise, bring their issue, and come to consult with OLA. But the way there is also another way that Chair just explained is we go to OLA. So that means we bring ourselves to the table and advise on them on that matter. So it's different approach, and it might work. Like OLA is always welcome additional resource, but for the community, it's the intent of the bill and the way it might not better serve with the community within the OLA. But we are willing to work with Chair with as well as the community. Like I say, different approach. But if we're gonna put the position within OLA, they have we would request more resource because currently OLA occupy a corner at the basement in Kioniana. We have only 500 square feet. We would not be able to accommodate the additional staff, and we would need additional resource. That's my comment, Chair. Thank you, Chair.
Okay. Yeah, so the concern that has been expressed, because, in light of, like, for example, BCCA's and others' comments, is that they support the intent of the measure, right? And then they see the value. However, those positions that would be instituted would not fall under the Office of Language Access. Is that correct?
That's correct, Chair. So they're gonna go back
So
to.
those individuals, if hired, would then be under the directive of the specific department directors.
That's correct, Chair.
Okay. So then there might not be any unified movement towards moving the language access might be partitioned out by department rather than moving forward and making all services accessible.
That the policy level, yes, it's up to the department head to decide on that part, because they are going to be the one who implementing it, that part. So even within OLA, so we can help coordinating, but it still go back responsibility, go back to each agency director to implement the language access obligation, Chair.
Okay. DHS, Director Betts?
Yes.
Hey, Director, hi, thank you for being here. The one other request is to have these decisions within certain departments, but not all. For example, it's not being requested to be part of DOT, not part of BNF, not part of DHERD, not part of several DLNR, only certain departments. Would it be better utilize if it was within one department assigned to help all departments, or is it better if it's, for example, specifically under, let's say, you having one assigned position?
Chair, I would defer to Office of Language Access on that particular question. We do have an LEP coordinator located in the director's office, exempt from civil service, that works really closely with Office of Language Access. And it has, having that position within our department has definitely helped us during times when we need to make sure that language access is top of mind, especially during the pandemic.
Okay, all right, thank you. All right, any further questions? Okay, seeing none, moving on to HB 1635 relating to healthcare. Department of Health.
Good morning, my name is Matthew Shim. I'm Chief of the Family Health Services Division. The Department of Health stands on its testimony, offering comments, and I'm here to answer any questions. Thank you.
Okay, thank you. Department of Human Services.
Good morning. Good morning, Chair, members of the committee. I'm Judy Moore Peterson. I'm the MedQuest Administrator, and on behalf of the Department of Human Services, we appreciate the members' intent. We provide comments, and we do request an amendment. Thank you.
Okay, thank you. Hawaii Center for Nursing.
Good morning, Chair, Vice Chair. My name is Laura Reichart. I'm the Director of the Hawaii State Center for Nursing. The center stands on our written comments related to HB 1635. And I also want to note to the committee that the Center for Nursing greatly respects the challenge and appreciates the need for specific efforts in rural health. And we've noted some of our work in that area. And also recognizes the specific challenge of recruiting in this time of a workforce shortage globally, nationally, and locally.
Thank you. Okay, so we have testimony submitted by the County Council, Alice Lee from Maui, Lanai Community Health Center, in support, both in support, everything's in support, Hana Health, Hawaii Primary Care, Molokai Community Health Center, Queens Health Systems, Liberty Dialysis, an individual BJ Ott, and comments provided by the American Nursing Association. Members, any questions? Okay, seeing none. Moving on to HB 1743 relating to pools. HB 1665 relating to health. Department of Health.
Good morning, Chair, Vice Chair, and committee members. Amy Curtis from the Department of Health. We stand on our testimony in opposition. Although this is an important issue, we have already implemented the National Suicide Prevention Lifeline into our into our statewide crisis line as of 2007. So this work has already been completed. Thank you. Let me know if you have any questions.
Thank you. Department of Human Services.
Good morning, Chair, members of the committee. I'm Judy Moore Peterson, MedQuest Administrator. On behalf of the Department of Human Services, we stand on our written testimony. We appreciate the measure's intent. We defer to the Department of Health and we provide comments. Thank you.
Thank you. Okay, we have comments provided by Victoria Fan and support from Samantha Bilo, Kirby Shaw, Randolph Hack, and Dara Carlin. Members, any questions? Okay, seeing none, moving on to HB 1743 relating to pools. Now I can call up Department of Health.
Hey, aloha, Chair, Vice Chair Tam, members of the Committee on Health, Human Services, and Homelessness. Peter Oshiro, I'm the Program Manager for the Food Safety Branch, and I do have jurisdiction over public swimming pools also. The department stands on its written testimony and support. Aloha.
Okay, thank you. Nice seeing you again. That's the only testimony we have. Members, any questions for Mr. Oshiro? Okay, seeing none, moving on. Moving on to HB 2138 relating to exemptions from civil service for positions in the Department of Human Services. Department of Human Services.
Morning, Chair, Vice Chair, members of the committee, Kathy Betts with the Department of Human Services. I'll stand on our written testimony supporting this administration measure. Also note that we are requesting an effective date of June 29th, 2022 to maintain currently filled positions in the Director's Office. Thank you.
Okay, thank you. We have testimony from Hawaii Government Employees Association in opposition. The rest are in support from Early Childhood Association Strategies, Parents and Children Together, Neighborhood Place of Kona, and individuals Rachel Wong, Justina Alvarado Cross, Sam Dorios, Jessica Kaneokua, and Malia Darabel. Okay, members, any questions? Okay, seeing none, moving on to HB 2141. Relating to reports to the legislature for the Department of Human Services. Department of Human Services.
Thank you, Chair. Kathy Betts with DHS. We'll stand on our written testimony in support of this administration measure. This just removes a couple of outdated reporting requirements for our Office of Youth Services and MedQuest division. Thank you.
Okay, thank you. All right, we have
1, 2, 3.
Okay, we have testimony. Oh, that's it. Okay, members, any questions? Okay, seeing none, moving on to HB 2145 relating to Kapuna Care Program, Office of Aging.
Good morning, Chair Yamane and members of the committee. Thank you so much for hearing this measure. The Executive Office on Aging stands in strong support of House Bill 2145 relating to the Kapuna Care Program. The purpose of this bill is to improve government efficiency by incorporating the Kapuna Caregivers Program into the Kapuna Care Program. The combined model will be an enhancement and will provide seamless approach to services and supports addressing the needs of both the older adults and their working caregivers. We strongly support this measure. Thank you.
Okay, thank you. We have testimony provided by all in support for Hawaii County Office of Aging, Agencies on Elderly Affairs, and Alzheimer's Association. All in support. Members, any questions? Okay, seeing none. Moving on to HB 2476 relating to spousal supports. Attorney General.
Yes, good morning, Chair, Vice Chair, members of the community, Deputy Attorney General Mark Nugent. I'm with the Child Support enforcement agency. So we appreciate the intent of the bill, but we have offered written testimony with suggested changes to the language of the bill to avoid ambiguity. I'm available for any questions that you might have. Thank you.
Thank you. And we have testimony provided by the Democratic Party of Hawaii in support. Members, any questions for the AG? Okay, seeing none, moving on. Okay, to HB 2058, relating to Waianae Coast Comprehensive Health Center Emergency Department, Department of Health.
Good morning. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its testimony, providing comments, and I'm here to answer any questions. Thank you.
Okay, thank you. Attorney General.
Good morning, Chair, Vice Chair, members of the committee. My name is Angela Takuda for the Attorney General. We submitted written comments on this bill and I'll be available for any questions. Thank you.
Okay, thank you. Waianae Coast Comprehensive.
Yeah, good morning. This is Richard Bettini, President and CEO. And for the most part, we'll stand on our testimony, but I did want to comment. I noticed the testimony by the Attorney General recommending a potential funding mechanism. And I don't know if that will work. We're open to anything that would increase our subsidy and allow us to keep our emergency department open. And so I did want to note, if that will get it done, we're very supportive of that recommended change in the language that would facilitate the bill. I do also want to say that it's very unusual to have a federally qualified health center operate a 24-hour emergency department with full-time lab, radiology, and professional staff. We greatly appreciate that the state of Hawaii has supported our emergency department for more than 20 years. Unfortunately, there's been no adjustment in the level of that subsidy. It's incredibly difficult to operate between midnight and 8 and break even when the majority of your patients are extremely low income and Native Hawaiian. So we see this as a part of health equity to continue to operate these services and support these services and recognize that our health center is an essential part of the EMS and disaster response system. Thank you very much.
Okay, we have testimony, comments provided by BNF, testimony from Hawaii Primary Care Association in support, and Kristen Kometa all in support. Members, any questions? Okay. Seeing none, moving on to HB 2155 relating to fees. Department of Health.
Good morning. Again, I'm Matthew Shim, Chief of the Family Health Services Division. The department stands on its written testimony in strong support. I would like to highlight one part of our written testimony. The marriage license agent fees collected and amounts deposited to the general fund have not changed for 24 years since 1998. And I'm available to answer any questions. Thank you.
Okay, thank you. Department of Human Services.
Morning, Chair, Vice Chair, members of the committee, Kathy Betts for DHS. We'll stand on our written testimony in support of this administration measure and defer to Department of Health. Thank you.
Okay, just a note to young people out there, gonna cost you $5 more to get married. All right. Okay, moving on to HB 23540 relating to controlled substances. Kaiser Permanente.
Morning, Chair, Vice Chair Jonathan Ching for Kaiser Permanente. We will stand on our written testimony in support of this bill, and we're available for any questions.
Okay, thank you. And then we have testimony in support from Dr. Rano Taniguchi. Members, any questions? Okay, seeing none, moving to HB 2391 relating to health, Department of Health.
Thank you, Chair Yamane and members of the committee. I'm Lola Urban, representing Director Char. The department supports the intent of HB 2391 and defers, of course, to the priorities of the governor's executive budget request. The task force would be something that the Department of Health would be responsible for, according to HB 2391, to determine the annual screening rates for lung cancer and to increase enrollment in the CT scans. And so We thank you for the opportunity to provide testimony.
Okay, thank you. Department of Human Services.
Good morning, chairs, members of the committee. I'm Judy Moore Peterson, MedQuest Administrator with the Department of Human Services. We stand on our written testimony. We appreciate the measure's intent. We defer to the Department of Health and we provide some comments. And of course, we respectfully request that any appropriation not reduce or replace budget priorities identified in the executive budget. Thank you.
Okay, thank you. American Lung Association.
Aloha, Chair, Vice Chair, members of the committee. I'm Pedro Haro, Executive Director with the American Lung Association. We, of course, fully support this bill, and we support also the amendments that are proposed by the Hawaii Primary Care Association, which is essentially just adding them to the list of requested members of the committee. We're available for questions. Thank you very much.
Okay, thank you. Okay, we have comments provided by the State Procurement Office, comments by BNF, Hawaii Medical Association in support, Hawaii Primary Care, University of Hawaii, Hawaii Public Health Association, all in support, Hawaii Public Health Institute, and both Cynthia Goto and Troy Ciruno in support. Members, any questions? Okay, seeing none, moving on to HB 2405 relating to insurance. Okay, DCCA, Commissioner Hayashida.
Hi, Chair, Vice Chair Ian Robertson for the Insurance Commissioner. Sorry about my camera. We stand on a written testimony offering comments and we're available for questions. Thank you.
Okay, thank you. I have here Kaiser Permanente.
Good morning, Chair, Vice Chair, committee members, John Kemitsu for Kaiser Permanente. We'd like to just start on our written testimony supporting the intent, offering a request for an amendment. And we also support the Insurance Commissioner's recommendation that an impact assessment audit may be necessary if these are considered new mandates. Thank you.
Okay, thank you. HMSA.
Hello, Chair, Vice Chair, and committee members. HMSA appreciates the intent of this bill, and as a supporter of the LGBTQ community, HMSA offers gender identity and transition services and is committed to providing clear information regarding our policies and appeals process. We do have a concern and want to register a comment in regards to this bill that it does create a conflict with the role of medical necessity, which is written in Hawaii Revised Statute 432E. The evaluation process of medical necessity is an important part of healthcare delivery and establishes a clinical determination for whether a service is appropriate, safe, beneficial, and involving restoring a health function. Further, because of state and federal rules, out of fairness, you cannot unilaterally offer a set of benefits for one part of the population, but deny to another. And with the removal of medical necessity, services would have to be covered regardless of clinical appropriateness, which would then recover coverage for the entire population. Should this measure move forward as a written mandate for benefit coverage, we do believe there would be an increased cost and raising of premiums. For the additional procedures beyond the ones that are already covered by our policy, we do estimate an increase of cost impact of potentially $7.7 million for the commercial line. Included in this would be a potential cost impact to EUTF of $1.5 million. If the medical necessity language is removed as written, these costs could be significantly higher. Due to this, we do also concur with the DCCA and Kaiser's testimony that the deferment per ACA requirement should require a state auditor impact assessment report. Thank you, and I'm available for any questions.
Okay, thank you. Jen Jenkins.
Aloha, Chair Yamane, Vice Chair Tam, and the Honorable Committee. My name is Jen Jenkins, and I'm testifying in strong support of HB 2405. This bill would continue, I have three main points to make. This bill would continue to allow insurance companies to make determinations on a case-by-case basis. So they would not be required to do any surgeries. They just wouldn't be allowed to say, to make blanket denials. So right now, for example, HMSA policy says that trans women can't get breast augmentation at all, even though they provide that for their cisgender patients. What we're saying is we want to just take that out of the policy and allow HMSA and Kaiser and every other private insurer to have their policy say, we'll consider it. We're not saying yes, but we are willing to consider it. Right now, they're not even willing to consider it. And that goes against Act 135, the anti-discrimination law based on gender identity. I also want to emphasize that Hawaii wouldn't be the first state to do this. In 2021, last year, Washington state clarified their same exact anti-discrimination law, recognizing that trans lives were at stake. And because that had been the intent of their original anti-discrimination law. So they did away with blanket denials, and they're now doing case-by-case basis too. So that's all that we're asking for you to do today. And finally, this measure is cost effective under HRS 432E-1.4, since according to EUTF estimates, it'd only be $20 per year per state worker. There's 73,000 state workers in the state. And the alternative to that, if these aren't done on a case-by-case basis, are suicidality and depression. Please pass HB 2405 as is, and if necessary, revert the language to SB 752, which is the exact same language that the Attorney General said makes it not a health mandate. Mahalo for your time.
Okay. Tiare Sua. Okay. In support, Jackie Nass. Okay. In support, Madeline Cesa Pasara.
Aloha Chair Yamane, Vice Chair Tam, and honorable members. My name is Madeline Sisipasara. I work at Hawaii Health and Harm Reduction Center, where I am the program manager for a transgender program called Ko'ana Project. I am a Samoan trans woman. I already submitted my testimony for HB 2405, and I stand behind it. I realize there has been some confusion at the legislature over the law, but two things are clear. Trans lives are at stake, and we need this to be corrected. And we have an attorney general who said our bill is not a health mandate, but a strengthening of anti-discrimination protections. Even if the insurance companies insist it's a health mandate, this legislature has the power to waive that audit. We ask that you do that now so trans people are not continue to be discriminated against and can live their true authentic lives. This is our lives. We need you to save our lives, please. Mahalo for your time, Chair, Vice Chair, and honorable members of it. Thank you.
Yeah. Wendy Taylor.
I'm testifying in strong support of this bill. A question I'd like to pose is why would insurance rather cover costs of the physical and emotional trauma that I have and will continue to endure without medically necessary gender affirming care than covering the gender affirming services themselves? We've been struggling to keep me on my needed medication for over 2 years after transitioning when I was 7 years old. I am now 13.
Thank you.
Okay, thank you. Hawaii Pacific Health Institute. Okay, in support, we have, let me go through that. We have comments by Union Health Benefit Trust Fund, all testimony. Oh, okay, who's that? Brianna Zoe.
Hi there, I'm here. I appreciate the 2 minutes. You got my written testimony and I'm not going to recite it, and I'll be available for any questions after that anyone might have. I just wanted to say that passing this legislation and getting its intent implemented, like everyone else has said so far, it's super critical to the safety and well-being of trans people just like me. Last year alone, my insurance company denied so much of my healthcare coverage, calling it not medically necessary, saying it wouldn't improve the quality of my life, saying that it wouldn't reduce the likelihood of self-harm and suicidality. I've been denied for so many nonsense reasons, and this legislation attempts to help address that issue and keep that from happening for people moving forward. On my personal healthcare, I'm bad with words. Sorry, I'm just an ordinary schmuck. This is new to me. But last year alone, I've had so much of my healthcare denied by insurance, like I just said. And let me tell you, every single time so far, I've challenged the insurance companies and their denials. My healthcare has been approved and overturned. I've been We've overturned their denials and got approved for things like breast augmentation, facial gender confirmation surgery, tracheal shave. And right now, we're working to overturn their denials on electrolysis hair removal. It's just the denials never end, and literally every fight turns in the patient's favor. There's no reason why we shouldn't implement this legislation to get the insurance companies on the right page and have them stop denying care, period. And this is going to be super heavy for me to share, and hopefully trigger warning touches on suicide. As a result of all my insurance companies' denials last year and some of the horrific things they said to me, I almost killed myself last year by suicide. Thank God I'm still here. Otherwise, I wouldn't have seen my 3 nieces being born last month. I want to be here talking to you folks. But honestly, now that I know how to beat insurance and get my care covered, I'm pretty much living my best life. Things have never been better. And it just shows that this healthcare saves lives, plain and simple. When people can't access the healthcare they need, suicide and self-harm go through the roof. Thank God I'm still here and I figured out how to beat the system. But we need to pass this legislation. If we don't pass this legislation, other trans people are going to get denied, and I guarantee you, we're going to lose more lives.
Okay, can you please summarize in the next sentence or two?
Sure. So, I mean, in general, for all the reasons in the written testimony, mine included, there is no reason why this legislation shouldn't pass. People's lives depend on it. I appreciate the time.
Okay, we have testimony from anybody else that signed up that I didn't know. Okay.
Chair, Michael
Okay.
Gloyu from the Stonewall Caucus, if I may.
Okay.
We stand in full support of this legislation. We know it will save lives. We know it's the best thing to do. And if you look at what happened in San Francisco when they offered these benefits to the trans members, it was negligible, whatever that word is, to the entire the rest of their payers. So this is a good thing, the right thing, and we thank you for hearing this bill, and we hope you move it forward. Mahalo.
Thank you. Okay, anybody else that was missed? Okay, seeing none. We have Kamukahi Health Wellness in support, Northwest Society Plastic Surgeons in support. We have all these in support, Hawaii Health Harm Reduction, numerous individuals in support, Hawaii Civil Rights Commission, Lavender Clinic, let's see, A Firm Hawaii, and a host of individuals in support. Members, any questions?
Chair, I have a question.
Okay, Rep. Ward.
Thank you, Chair. Brianna, a question. When you had the insurance company deny you, did they not consider the mental health issues that you brought up, or they just put those aside?
Thank you for the question, Representative Ward. I address some of that, I believe, in my written testimony. In short, I want to say the answer from my perspective is no. I don't think the health insurance company has considered any of the mental health perspectives of this care, let alone do I think they've considered any of the information me and my providers have submitted to them. They've basically disregarded anything I've said, anything my providers have said, anything the scientific and medical literature says. They pretty much have just outright denied it, saying not medically necessary, doesn't improve quality of life. There's a whole list of horrific reasons in my testimony, the exact quotes from the insurance company.
Unfortunately, we don't get the testimony of people until about 10 minutes before the hearing. So prepping is usually during the Q&A. So my apologies for not having it, but that's the way we're structured in the community. From what you said, the obviously next question would be to HMSA or White Pacific Health. Is anybody on, Chair, who is those vintage?
HMSA is on.
HMSA, good. I ask, is the rationale that you just heard something that you guys don't accept? The suicide rates, you know, the difference between the rural population and the trans population? And clearly that's a health issue. Question mark.
Thank you, Representative, for the question. I do want to note that HMSA does cover 9 of the services that are listed in this bill. In addition to that, we do cover services such as psychotherapy, sexual identity counseling, and other services of counseling to support the behavioral health and mental health aspects that come with the health concerns that are being discussed right now.
So which one don't you cover then? You said 9. Which one is not covered?
Correct. Our focus on coverage are related to the ones that we believe do have medical necessity and provide value for restoring or improving function. The ones that we do not cover are ones such as breast augmentation and feminizing surgeries, facial feminizing surgeries. We also cover smoking cessation, but as a smoking cessation program, not directly related to gender transition.
If you did cover those that you said you do not cover, what would be the cost of the rate increase that is anticipated, even though Mr. Blow, you said in San Francisco, it's been negligible?
Sorry, Representative, you cut out a little bit, but I think your question was, what would the rate increase be if we did cover the services that we have listed as not currently covered? In our testimony, we do list that specific to the commercial line of business, there would be about $7.7 million, with $1.5 million being aligned towards EUTF.
You divide it up by your membership means how much premium increase per month or per year?
You know, I apologize, Representative, I can't provide that number right now, and it's mostly also because there's a lot of more complexities that go into the rate increase from an actuarial and underwriting perspective.
Yeah, I don't do math in public. That would. Thank you, Chair. I think.
Okay.
Thank you, Representative.
Questions? Okay, the chair has questions for the insurance division. Is that Ian still on?
Yes.
Okay. In your testimony, you mentioned that some of the language that's provided in this bill can be construed as circumventing the analysis for medical necessity.
Yes.
However, from the various testimony, all of them are mentioning that it was medical necessity for the various services that are being denied. Why are you? What is the department's I guess rationale for saying regarding the circumvent for the medical necessity as provided in this proposed measure?
I think we're specifically talking about the new subsection D that's proposed. It includes the phrase, all care services related to gender transition treatments shall be considered medically necessary. And so that phrase by itself appears like it could be construed to suggest that any of those services would not be subject to medical necessity analysis.
So in that sense, does that mean that it doesn't need to be referred by PCP and that those services then would just be consumer based, or what is that? I don't, can you clarify on your guys' interpretation?
Well, medical necessity is covered under 432E 1.4. And that's the process that some of the other testifiers have talked about in assessing whether services meet that standard. Our concern was that this language would potentially be construed to suggest that the services that are described here would not be subject to that process. And
so
it
that
would
means no doctor review as other services are? Is that your assessment?
Yes, it would not be subject to that medical necessity review like other services are.
Okay. Does that mean processes that might be potentially dangerous then be also reviewed, or how does that work? Because I know currently services go through some type of physician referral process, right? And if it's denied, as stated earlier by one of the testifiers, it's a tug of war back and forth. But is allowing that to happen then? What about other services that may or may not be in these categories as described, but may not be, I guess, recommended by a physician? Would that be stopped, or how would that go? How would that happen?
It's not clear how this would be implemented, but the way the language is drafted, it looks like whatever we would normally consider to be part of this medical necessity analysis would be circumvented by this language being in the bill.
Okay. Is the current process of people's services or requests for in the current process being denied, is there an appeal and mediation process that's reviewed by a third party to make sure it is appropriate?
Yes, there's actually a kind of a two-step process that's provided for in Chapter 432E. There's a internal appeal that can be filed with the health carrier, and if it's denied at that point, then that medical necessity determination can be subject to a external review. And for the external review, the consumer would be filing that request with the insurance division. And if the request were approved, then it would go to an independent review organization.
Okay, but then with this going through, then that process for these services would no longer be needed, right? Because it would just be approved.
It's not totally clear what would happen with this. I'm not aware of other processes where a specific class.
If they're approved, then there wouldn't be an appeal, right?
Yeah, if they were approved, there would be no adverse decision to appeal.
Right. Okay.
Yes.
And then there was another question presented regarding then that if due to some federal law requirements, if one protective class gets services, are we required to provide it to all classes?
I'd have to get back to you on that. I'm not sure what federal law that's referencing.
I think somebody in one of the testimonies referred to CMS, but so if one groups get a services, does that mean other protective class then are allowed or access to that, or?
I'm not aware that if any federal law is interpreted exactly that way. We are aware of
that, you know, if this is offered, because I think it's needed, right, as mentioned by the testifiers, but then does that mean then other classes can say that they are that they should have the same rights to those services as well? Is that possible?
I'm only aware of the ACA section 1557 discussion. That's the federal law, and that references anti-discrimination. I'm not aware that it's applied exactly in that way. Sorry.
So all those federal laws regarding discrimination and consistency wouldn't be applicable here?
They would potentially be applicable, but those are not those aren't within our jurisdiction. Those are within the federal government's jurisdiction.
Thank you. Okay. All right. Any questions? I see fellow represent. Okay. Representative Har, you have a question? Okay, I guess not. Okay, then moving on to HB 2318 relating to mental health licensing. Okay, we have Democratic Party. Okay, in support, Board of Psychology.
Good morning, Chair. This is Christopher Fernandez, Executive Officer for the Board of Psychology. The board's legislative committee wishes to stand on its testimony, appreciating the intent and offering comments. Thank you.
Okay, thank you. Hawaii Psych Association.
Good morning, everyone. Thank you. The Hawaii Psychological Association during the pandemic has been acutely aware of disparate mental health outcomes for minority communities. For example, suicide was the leading cause of death among Native Hawaiians, Pacific Islanders, ages 15 to 24. Native Hawaiians and Asian Americans are significantly less likely to receive mental health services. Now, what is Hawaii Psychological Association doing about this? Well, we're supporting a number of pieces of legislation this year that address diversity, and we've proposed HB 2318, which would require that 3 of the 18 continuing education credits that psychologists need every 2 years to renew their licenses be in cultural diversity. There are things that can be done to improve the situation. For example, psychologists could locate their offices in places like Kalihi or Waianae in order to meet people where they are at. This initiative was originally proposed by HPA's Diversity Committee. Our membership supports it. and 10 other states have adopted similar measures. I think Hawaii, being the most diverse state, should not lag behind. And I think we shouldn't wait any longer to pass this legislation. Thank you very much.
Okay, we have testimonies from Samantha Bilo in support and Ellen McKee in support. One last time for the Hawaii Democratic Party.
Sir, Chair, it's Michael Guloyu on behalf of the Stonewall Caucus, not on behalf of the party, but on behalf of the caucus. You have our written testimony, which asks for an amendment, which would expand, because everything that's been brought up about the minority communities, it is exasperated when you add the sexual orientation or gender identity to somebody. So we encourage you to add our amendments to this bill to ensure that people of our community have access, because what we've heard time and time again is the fact that people were denied health services because somebody didn't understand, didn't even have a clue when it came to sexual orientation or gender identity. So mahalo for the time to testify, and mahalo for the I hope you will support our amendments. Mahalo.
Okay, we have testimony from members, any questions?
Chair,
Okay. Professor
question.
Ward.
To the Hawaii Psychological Association, Mr. Lee. Do we have the numbers that you noted, at least the preponderance of various minorities in terms of depression? We know the percentage of suicides among Hawaiians, Pacific Islanders, Japanese, Chinese, Asians, Filipinos. Do we have those numbers?
I don't have it right now in front of me. I'd be happy to look into the research and get
Does
it for you.
anyone on this Zoom know those numbers? Because the bill is based on the premise that, hey, this is really out of whack. We should, obviously, the chair knows I like to have metrics, but when the bill states that, the bill almost implies that some cultures are inferior, which is a big lie, quite frankly. And the biggest correlation with health. Sorry, Mr. Alec?
I don't follow that you say the bill implies that some cultures are inferior. I mean, they're having disparate outcomes.
Okay.
We don't take that. In fact, we take the opposite position.
Having been a Peace Corps volunteer, knowing the human value and personal worth of every individual deserves full equal access opportunities, etc. So I'm saying this looks pejorative until I see the numbers, because it may be Caucasians and everything are the same, which means there's not a desperate. But I'd like to see the metrics, because in terms of health, generally the highest correlation with health is socioeconomic status, what your education and what your income is. And I would like to see some kind of a tabulation that says, hey, this is probably because 48% of the people of Hawaii, the Alice study, says we're one paycheck away. That is depressing. That is enough to push people over the brink. Having said that, without the data, Chair, back to you. Thank you.
We'll get the data for you. Can I just say that? Can I just comment on somebody else's testimony?
No,
if you have
you have to respond to a question.
Alec, I want to ask you the question so you can respond to whoever that question was. It's probably not me. Please proceed.
Go ahead.
Yeah, please go ahead.
I just want to say that gender identity is covered under this. Diversity is covered very broadly. It would have to be accredited by the American Psychological Association, and that does include gender diversity, LGBTQ, etc.
Chair, may I respond?
Please.
Representative Ward, when you look at
Mr. Gold, direct it to the chair.
I'm sorry. I apologize. So when people talk about discrimination, when you go from gender versus ethnicity, it just, without lack of a better term, the shit rolls downhill. And so it becomes very much a thing when it comes down, when you're looking at discrimination and not being able to access the same rights and privileges as your others. So when you add sexual orientation and gender identity to that entire discrimination plank, it becomes worse as you go down the tool. So Chair, I think that everybody needs to understand that when it comes to anything, accessing benefits at any level, that when you add somebody's sexual orientation or gender identity that's outside of what's considered the norm, they have a less ability to access those benefits. So we encourage anything that removes those barriers. Does that make sense?
Yeah.
Or am I
Thank you.
whatever?
Okay.
So thank you, Chair.
Chair, let me respond by thanking Mr. Gloyu, because if that's a bigger independent variable, that is something that is big importance. If it still, how would you say, trumps the socioeconomic that decades study after study has indicated as the biggest indicator, that would be a new discovery. So thank you, Mr. Gloyu.
Okay, thank you. Members, any discussion? Okay,
For Alex, Mr. Lechon, just to confirm, the sexual orientation, gender identity, these are already covered as things that people like yourself, psychologists, can have to continue to get education on, correct?
Yes, under this bill, the continuing education requirements for renewal could include gender discrimination, LGBTQ issues, etc. It is under that definition, yes.
Okay, thank you.
Okay, thank you. Any further discussion? Okay, seeing none, moving on to HB 1556 relating to taxation, Department of Taxation.
Thank you, Chair, Vice Chair, and members of the committee. Teresa Zetwick on behalf of the Department of Taxation. We stand on our written testimony offering comments and are available for questions. Thank you.
Okay, thank you. Tax Foundation.
Good morning, Chair and Committee. This is Jade McMillan on behalf of Tamia Machika and the Tax Foundation. We submitted written comments on the measure. We'll stand on the written comments. Thank you very much.
Okay, thank you. Okay, we have comments from Budget and Finance and testimonies from Queens Health Systems in support, Randolph Hack in support, and Kim On Nguyen Blood Bank of Hawaii in support. Anybody have any questions?
Mr. Chair, may I?
Oh, okay, Mr. Goyu.
Yes,
we didn't know you're testifying, so please proceed.
I'm sorry.
Okay.
It was late. I apologize. We support the intent, but if this moves forward, it would create a as put in today's Star Advertiser, be a disincentive and actually a possible discrimination against gay men that are not allowed to donate blood because they're gay. So we encourage you to move this bill forward, but we want the blood donors be able to donate without discrimination. So thank you.
Thank you. Okay. But Mr. Gloyu, you might want to resubmit your testimonies so that it's in the public record. Okay. Moving on.
We'll do, Chair.
Okay. Okay, members, any questions? Okay, seeing none, moving on to HB 2394 HD1 relating to Medicaid patient care. Department of Human Services.
Good morning, Chair, members of the committee. Judy Moore Peterson, MedQuest Administrator with the Department of Human Services. The department, we stand on our written testimony, appreciating the measure's intent. We do respectfully request that any appropriation not reduce or replace budget priorities identified in the executive budget. Thank you, and I'm available for any questions.
Okay. Thank you. BNF has you trained. Good. Healthcare Association of Hawaii.
Good morning, Chair Yamani, Vice Chair Tam, members of the committee. My name is Hilton Rathel. I'm President and CEO of the Healthcare Association of Hawaii. Thank you for the opportunity to testify in strong support of this bill. This measure would provide critical relief funds for the state's nursing homes through a one-time enhanced Medicaid payment, similar to what was instituted in most other states during the pandemic. As this committee knows, the pandemic has been extremely difficult for healthcare providers because of increased costs due to labor, supplies, screening, testing, PPE, and other factors. The cost of labor for nursing facilities is approximately 60% of their total costs, and because of the shortage of nurses and of the high demand for frontline healthcare workers, especially during the pandemic, many of our nursing facilities have had to increase salaries to try and remain somewhat competitive with hospitals, and on occasion hire on expensive agency nurses to ensure adequate staffing for their residents. The entire pandemic, but especially the Delta and Omicron surge, have severely stressed the finances and staffing in the state's nursing facilities in 2021, which is why we're coming to the state for some limited relief. We understand there are many competing priorities for funding. We are working on a number of longer-term solutions to address staffing shortages in our hospitals and nursing homes. We are requesting support for our nursing homes that would provide meaningful relief and that would demonstrate that they have not been forgotten during these very challenging times. Thank you for your consideration.
Okay, Kaiser Permanente.
Morning, Chair, Vice Chair Jonathan Ching for Kaiser Permanente. We'll stand on our written testimony, echoing a lot of the comments made by the Healthcare Association. Thank you very much.
Thank you. Queens Health Systems.
Aloha, Chair, Vice Chair, J.C. Mike Yelanek on behalf of the Queens Health Systems, and we'll stand on our testimony in strong support, echoing the comments that HAH has provided as well. Thanks so much for hearing this measure.
Thank you. We have comments provided by Budget and Finance. All testimony in support. Testimonies in support are from Full Chinese Home, The Villas, Garden Isle Rehab, Legacy Hilo Rehab and Nursing, Hale Makua Health Services, Pu'uvai o Makaha, East Hawaii Region of Hawaii, Hawaii Health Systems Corporation, ANPRO Rehabilitation and Nursing, Hawaii Pacific Health, Aloha Nursing Rehab Center, Ohana Pacific Health, Hawaii Health Systems Corporation, Ohana Pacific Management Company, Hale Makua Health Systems, and 3 individuals, all in support. Members, any questions? Okay, seeing none, moving on to HB 1933 HD1, relating to persons working with children. Okay. Right, we have here Catherine Jian.
Yes, Chair. My name is Catherine Alamea Jian, and I am testifying as an individual. And thank you, Chair Yamane and Vice Chair Tam, members of the committee, for hearing this very important and long overdue measure. I strongly support this bill. It's in great need. It will fill a much needed gap in family court proceedings. I submitted testimony for suggested amendments because as it is written now, it unintentionally excludes the applicability of this measure to custody evaluators, which are one of the hugest problems that this bill was intended to focus on. The amendments I submitted with my testimony address the inclusion because as such, as it is now, court doesn't contract with custody evaluators for the assessment of the safety of parents. They actually order custody evaluators to then contract with both parties in a matter. And so that technical language has been addressed with the amendments I submitted. Furthermore, we highly recommend, as does the Blue Ribbon Commission and their submitted report to the New York governor, that individuals who are violated by these biased custody evaluators for whatever reason, be it by sex, sexual orientation, race or economic status, that they have an opportunity for redress, which is a constitutional right. Right now, as the bill is written, it only offers redress for the state. And we highly recommend that the committee include an opportunity for individuals who are essentially have their constitutional rights impinged upon by these custody evaluators to have this cause for civil action. Thank you for the opportunity.
Okay, thank you. Okay, Jonathan Stremel. Okay, in support, Nonohe Botello.
I'm here, thank you.
Okay, go ahead, please proceed.
Hello, aloha, my name is Nonohe Botello. I'm an independent consultant for victims of homicide, and I've been working in the criminal side of the court for some 15 years. Prior to that, I worked in family court and for 15 years, and I have to tell you that the difference between the rights of the criminal in criminal court have more rights than they do in family court. The respondents, the defendants in family court are being stripped away of their parental rights, and their children are being removed based on fact-finding reports. The concern I have with these fact-finding reports, and I testified before, is I've seen many fact-finding reports and several right now cases that I have that are riddled with mistakes and errors and outright fraud. And these kinds of fact-finding reports are being submitted to the family court, where families are stripped of their constitutional rights. I'm blown away by this, that how can the in criminal court defendants have due process and have their rights, whereas family courts, we do not. Families do not have the rights, they're stripped away. And I agree with Catherine Amia on her amendments that this has to apply to not only contracted workers, but to the custody evaluators who are submitting these reports to family court. I've seen so many families and children torn away without a full investigation. And basically, I am saying that some of these fact-finding reports, not all, but some of them are riddled with fraud and fraudulent reports, and the respondents in these cases have no redress. And this has to be just because it flies in the face of all of our constitutional rights we criminals get in criminal court, whereas family court, it's different. It's a different standard, and we just should not have it. And so I am asking also that, do you have an effect?
Can you please summarize? Can you please summarize in one sentence?
Yes, you have an effect 1,112. That's 90 years from now. We need to continue to work on this and have this within a few years. Okay. This tragedy start happening. Thank you so much.
All right, thank you. Okay, all following testimonies in support: Hawaii Appleseed individuals, Jennifer He, Thomas Davis, Chris Wee, Sandy Narvaez, Jim Brule, Hawaii Family Advocacy Team, Dara Carlin, and Kelly Glatthorn, all in support. Members, any questions? Great. Seeing none, moving on to HB 1794 HD1 relating to opioids. Hawaii Department of Health.
Aloha, Mr. Chair, Vice Chair, and members of the committee. John Valera from the Alcohol Drug Abuse Division from the Department of Health. We stand on our written testimony, offering comments on this measure. In addition to our written remarks, we request an additional amendment to Section 2 to clarify that the scope of the work group in Section 2 is for opioids and value-based purchasing. We can continue to work with the Hawaii-based Substance Abuse Coalition to have a separate work group and address any concerns they've pointed out in their prior testimony. And with that, I'm available for questions. Thank you very much.
Okay, thank you. We have testimony from the Hawaii Psychiatric Medical Association providing comments. Members, any questions? Okay. Seeing none, moving on to HB 2392 HD1 relating to health. Sorry, did I say HB 2392, right? Okay, relating to health. We have Department of Health.
Good morning, Chair, Vice Chair, and members of the committee. Thank you for the opportunity to testify today on behalf of the Department of Health. I'm Sarah Campbell, the state epidemiologist, and we have submitted written testimony. We stand on our testimony in support of HB 2392 and stand by for questions. Thank you.
Thank you. Okay, we have testimony from Department of Budget and Finance providing comments. Hawaii Medical Services Association in support. Hawaii Primary Care Association in support. Members, any questions? Okay, seeing none, moving on to HB 2437 relating to taxation. Department of Taxation.
Thank you again, Chair, Vice Chair, and members of the committee. Teresa Zetwick on behalf of the Department of Taxation. We stand on our written testimony offering comments and are available for questions. Thank you.
Okay, thank you. Tax Foundation of Hawaii.
Good morning, Chair, and members of the committee. Jade McMillan on behalf of Tax Foundation of Hawaii. We will stand on our written comments submitted on this measure. Thank you.
Okay, thank you. Members, we have comments provided by the Department of Budget and Finance, Hawaii State Center for Nursing, and again, Tax Foundation, and testimonies in support from the Hawaii American Nurses Association, Dara Carlin, and Danielle Paul Ross from the Hawaii Nurses Association, Local 50. Members, any questions? Okay, seeing none. Okay, to everyone listening and other members, we will be recessing this agenda for decision making following our joint hearing with PB Pandemic Committee, which starts at 11. Okay, so we will be taking a recess, decision making to follow that. Thank you. Bye. Okay, reconvening the Committee on Health, Human Services, and Homelessness for the purpose of decision-making at 9 a.m. Tuesday, February 15th, 2020, 22 agenda. Hold on. There's a. How do I get it? With the volume? Okay, how's that? All right. Okay, thank you. Okay, first bill, HB 1762, relating to language access. Members, the recommendation of the chair is to move this measure forward for the Filipino caucus. Members, in light of the testimonies from the one of the departments, as well as it's not noting many of the other departments that may need this access to this important services, the recommendation of the chair is to modify the bill in regards to having 3 positions within the Office of Language Access. Those 3 positions then will have specific working instructions to work with all departments to meet federal and state access requirements. We're going to be making some technical amendments and putting a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1762, Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Rep. Gates.
Aye.
Rep. Har.
Aye.
Rep. Capella.
Aye.
Rep. Nishimoto.
Aye.
Rep. Ward. Rep. Ward, I need your camera on. Rep. Ward excused. Chair recommendation is adopted.
Thank you very much. Okay, moving on to HB 1635 relating to healthcare. Members, the recommendation of the chair is to move this measure as requested from some neighbor islands colleagues to move this measure forward. We're going to change the effective date to 7/1/2060 and put in technical amendments. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1635, Chair's recommendation is passed with amendments, noting members that are currently present and the excuse of Rep. Ward for the rest of the agenda. Anyone with reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving to HB 1665 relating to health. Members, a recommendation of the chair is to continue this discussion so we can solidify the issue of redundancy potentially with 988 calls. So we're going to make technical amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1665, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to HB 1753 relating to pools. Members, the recommendation of the chair is to move this measure forward, making some technical amendments and putting a 7/1/2060 the effective date. Members, any discussion about this body of water bill? Okay, seeing none, Vice Chair.
Voting on House Bill 1743, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, moving on to HB 2138 relating to exemptions from civil service positions in the Department of Human Services. Members, the recommendation of the chair is to move this administration bill forward. We're going to be making some technical amendments and then putting a 7/1/2060 effective date. Members, any discussion?
Yes.
Rep.
please,
Capella?
Chair. I truly believe that one of the things that's incredibly important is listening to unions. And I think that in many ways that this bill can possibly water down labor rights. So respectfully with that, I'll be voting with reservations.
Okay, thank you. And then Representative Capella, the chair will make a note of that and make sure that we can have a dialogue with HTA.
Thank you.
Okay, thank you. Members, any other discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2138, Chair's recommendation is to pass with amendments. Noting reservations from Rep. Capella. Anyone else with reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Moving to HB 2141 relating to reports to the legislature for the Department of Human Services. Members, the recommendation is to move this admin measure forward. We're going to make some technical amendments and put a 7/1/2060 effective date. And the chair will continue to evaluate if the reports are valuable or not. Members, any discussion? Seeing none, Vice Chair.
Voting on House Bill 2141, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to HB 2145 relating to Kupuna Care Program. Members, we've seen this measure before. Recommendation of the chair is to move this measure forward as in HD1. We have been told that there is some language regarding coaches that's in here. However, it's not reflective in the current statute. So we will have to delete it to make sure it comports to the current law. We're going to be making some additional technical amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2145, Chair's recommendation is passed with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to HB 2476 relating to spousal support. Members, the recommendation of the chair is to move this measure forward. We're going to incorporate the Attorney General's amendments. We're going to make technical amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2476, Chair's recommendation is to pass with amendments. Any members with reservations? Any no votes? Chair recommendation is adopted.
Thank you, members. Moving on to HB 2058 relating to the Waianae Coast Comprehensive Health Center Emergency Department. Members, the recommendation of the chair is to move our committee's colleague, Representative Gates' bill forward. We're going to put in the Attorney General's recommendations. We're going to blank out the amount. We're going to make some technical amendments. And members, we're going to be deleting the preamble. So that is reflective of what the bill's purpose is, which is basically a general revenue appropriation. And we're going to put a 7/1/2060 effective date. Members, any discussion?
Chair,
Representative Gates?
I would just want to thank you for moving this measure, as this is an important issue for my community on the Waianae Coast. As you know, we're in a rural district, and the emergency room serves as one of the only lifelines for many of the residents out there. So thank you, and thank you, the committee members, for moving this measure. Mahalo.
Thank you for being a strong advocate. Okay, thank you. Members, any further discussion? Okay, seeing none. Vice Chair, please take the vote.
Voting on House Bill 2058, Chair's recommendation is passed with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Thank you, members. Moving on to HB 2155 relating to fees. Members, the recommendation of the chair is to move this measure forward, this admin measure forward. The fee is only a slight increase to assist with licensing, and it's really vital for Mr. Kim's vital records area. So members, the recommendation is to move this forward with technical amendments and putting a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2155, Chair's recommendation is passed with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Okay, moving on to HB 2340 relating to controlled substances. Members, the recommendation of the chair is to move this measure forward. We're going to incorporate Kaiser Permanente's amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2340, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Okay. Okay. Moving to HB 2391. Too ahead of myself. Relating to health, members, the recommendation of the chair is to move this measure forward. The American Lung Association has been working hard with various stakeholders. We're going to be making technical amendments. We're also going to delete a portion of the preamble to where it goes to page 3 to the purpose of the act, and we're going to put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2391, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair, your recommendation is adopted.
Okay, members, HB 2405 relating to insurance. Members, the recommendation chair, we're gonna move this measure forward. As you heard from the discussion, there is some questions that we want to give more time for DCC and others to clarify. So this is what we're going to do. Members, we're going to change some of the shalls that mandated to may. That way, from what we've been advised is that that would still, again, I'll rely on that the physician PCP referral would be part of the process. So make sure it's medical need. Members, we're also going to delete smoking cessation as one of the listed, since many smoking cessation therapies are already covered. And there was some question regarding how it's directability specifically to transgender process. Members, there has been a question that we might have to deal with legally. So we're going to be looking at language in regards to making sure that there's some kind of medical guidance. So we're looking at language that is accordance with the most recent information provided by evidence-based peer review language to make sure that it's, it follows some type of medical referral process or guidance in regards to the service being appropriate. And so we're going to put a 7/1/2060 effective date and then move it forward for continued discussion. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2405, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair, your recommendation is adopted.
Okay, well, thank you, members. Moving on to HB 2318 relating to mental health licensing. Members, the recommendation of the chair is to move this measure forward for continued discussion. We're going to put technical amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2318, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair, recommendation is adopted.
Okay, thank you. Moving on to HB 1556 relating to taxation. Members, the recommendation chair is to move this measure forward. We're going to incorporate the testimony from the Director of Taxation regarding taxable year, which was requested to be delayed until, I think, 12/31/2022. We're going to need to make some technical amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1556, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to HB 2394 HD1 relating to Medicaid patient care. Members, the recommendation of the chair, even though there's a long preamble, would be to move the measure as is since it already went to PDP. Members, any discussion? Seeing none, Vice Chair.
Voting on House Bill 2394, House Draft 1, Chair's recommendation is passed unamended. Any members with reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members. Moving on to HB 1933 HD1 relating to persons working with children. Members, the recommendation of the chair is to move this measure forward. We're going to make it an HD2. Okay, we're going to incorporate some language and text amendments so that technical amendments. Also, we're going to incorporate one of the suggested testimonies to make sure that it is expanded to include other than just contracted. So we're going to include language that it'll involve contracted, assigned, delegated, ordered, appointed, or any other act allowed. So whenever this would apply, would be to any one of those. And we're going to be putting a 7/1. Oh, there's actually already an effective date. So that's what we're going to include. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1933, House Draft 1. Chair's recommendation is to pass with amendments. Noting any members with reservations? Any noes? Chair recommendation is adopted.
Okay, then moving on to HB 1794 HD1. Members, the recommendation of the chair would be to move this measure forward. The DOH amendments are not substantive. And so we're going to move it with the DOH amendments as an HD2. Members, any discussion? Oh, and tech, sorry, and tech amendments as recommended by HMSO. Members, any discussion? Seeing none, Vice Chair.
Voting on House Bill 1794, House Draft 1. Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to HB 2392 HD1 relating to health. Recommendation of chairs to move this emergency appropriation as is. Any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2392, Chair's recommendation is to pass as is. Any reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to the final measure, HB 2437 relating to taxation. Members, the recommendation of the chair is to move this measure forward. This bill hasn't been effective, so the recommendation would be to put a 7/1/2060 effective date as part of the HD1. Members, the recommendation also would include a report by the Center of Nursing back to the legislature due 12/31/2024 to express to the legislature the value of the credit. And then it'll sunset 12/31/2025. Members, any discussion? Seeing none, Vice Chair.
Voting on House Bill 2437, Chair's recommendation is to pass with amendments. Any members with reservations? Any noes? Chair recommendation is adopted.
Okay, we're adjourned. Thank you.